in the healthcare world, we can do a far better job in providing care to women. When it comes to identifying cancers in women, when it comes to identifying heart diseases, when it comes to identifying depression, so many of the illnesses, the healthcare world, we are not doing as good a job. And there truly are areas of opportunity for us to do better. It's well recognized fact that heart attacks are missed by the physicians when it comes to women's health, because people have this perspective that estrogen is protective for heart related diseases, and as a result, when a woman has the classic symptoms of chest pain, discomfort, shortness of breath, it's missed because people think that there's some protection that is in place. And the important thing is you have to look at it from the perspective of actual symptoms and make sure that we are not missing heart diseases. When it comes to breast cancer, we have tried to increase the awareness on breast cancer, but we also need to recognize that when the individual needs screening for breast cancer, if somebody has dense breast tissue, they will need a breast ultrasound to be able to identify cancers. I recently had a situation where one of the patients, even though we have passed a law, but despite that, the insurance company was charging her because she had to have a breast ultrasound. And then I had to go all the way to the commissioner of of insurance committee in the insurance department in Connecticut to say, why is this that we are doing this? And insurance companies are trying to find ways of not having to pay for screening tests at times, and it's quite frustrating. From the data that I recall, over 11,000 women in the United States had cancer when they were much younger than the screening age. So we do need to recognize that 40 is not like a magical number after which the cancers will suddenly increase, but it's based on statistical analysis that's not 100%. If somebody is at a high risk, if somebody has genetic risk that is going to place them at a high risk of having cancers, their screening needs to start at an earlier age. And then there's relevance to this, and there's a relevance to looking at it from the patient-centric, risk-based approach to find out how we can identify these cancers, whether it's breast cancer, whether it's colon cancer, whether it's prostate cancer. All of those cancers, you need to look at it in the realm of their relationship with risk factors of an individual. And also newer technologies are available which would help us identify this better. You can do 3D reconstructions, not only of the ultrasound, but also of the mammogram, which can help us. We have been pushing for some of these laws to try and protect the women.